Hello, I'm Dr. Serena Jones. I'm Clinical Director here at CheckupHealth. I'm an NHS GP and I have special interest in women's health. So today I want to talk about breast cancer because it's the most common type of cancer to affect us women here in the UK. They say roughly between 1 in 7 and 8 of us women will go on to develop breast cancers at some stages in our life. So it really is important to examine as much as possible. Now, we also get asked, can men develop breast cancer? And they can. It's very rare. It actually accounts for less than 1% of all breast cancers diagnosed each year. But just so that men are aware, they should self-examine as well. Now, ideally, we want to be examining at least once per month. And usually it's easiest done in the shower. Now, there are lots of resources out there that will talk you through how to do a proper breast exam. But the important thing to remember is you can't get this wrong. You just need to remember to examine both breasts all the way up to the shoulders and underneath the armpit as well, on both sides. Now, you can look for any changes at all, any skin changes, any rashes that aren't disappearing, any nipple discharge, any signs that the nipples are starting to turn inwards, or of course, can you feel a lump anywhere at all? Now, ultimately, if you find any changes at all, it's really important that you speak to your GP as soon as possible, who will examine you and then decide what the next best course of action will be. Now, it's really important to remember not all breast lumps are cancer. And Dr. Katie Stevens from CheckUp has actually written a lovely blog on different types of breast lumps that you can read on our webpage. Now, there are a few things considered to be helpful in trying to prevent breast cancer developing. Now, these include things like regular exercise, keeping your vitamin D levels topped up, breastfeeding, and also maintaining a nice healthy weight. Between the ages of 50 and 70, you will be invited to a national screening programme where you will have a mammogram done every 3 years. Thank you for listening. If you have any comments, then please don't hesitate to pop them in the comment box below. I really hope this has been helpful. And if there are any other topics that you feel that may well be helpful to you, then please pop them in the comments and we'll certainly consider them for future videos.